University of Johannesburg's Vice-Chancellor, Professor Chilizi Marwala, says there's no link between the 5G mobile spectrum and the coronavirus. It's after 4 of the country's leading network providers were recently vandalized. This is the cell phone towers for those providers in KwaZulu-Natal as a result of the conspiracy theories. Marwala also argues that the spectrum does not pose any health risks.
The issue of spectrum is very, very important. The minister last year actually issued policy guidelines on the issue of this spectrum. Unfortunately, there is a court case. I think Telkom has taken the ministry to court, the ICASA to court, so that the distribution of spectrum is done in a way that they think it should be done. And this will obviously have an impact of delaying the rollout of spectrum. But I think it is very important for us to understand that 5G is very important and we need to implement it much more sooner. Because with 5G, you will be able to do things like telemedicine much more effectively than we have ever dreamt about. So somebody will be sitting in a village hospital and a high-level doctor will be in Cape Town, and they will be able to supervise an operation remotely, even using robots, certainly because the reaction time that is going to result out of communication using 5G is going to be much quicker.
So why have the claims of a link between 5G and coronavirus become so popular? Well, we're joined by Media Monitoring Africa Director William Byrd to help us understand the phenomenon that's at play here. William, good evening, and thank you so much for your time. It really comes down to how misinformation has been spreading and how it can actually be perceived as real by members of the public.
Yeah, good evening. So, you know, when there's an information gap and when there's a lot of uncertainty about things, that's when that's the perfect environment for mis and disinformation to thrive. And that's pretty much what we're seeing here. You know, these rumors around 5G are not new. We saw in the UK, I think probably in the earlier parts of 2020, people going and attacking cell phone masts there on pretty much the same basis. I think the most worrying element is that when you get these claims being made by fruitcakes, it's one thing, but when they're made by people who hold a public office, as we know that some of them have been made, then that becomes a very real challenge and a very real problem, because you've got people in authority making claims that are clearly dubious and clearly fundamentally just wrong.
William, why is it that the education around misinformation, how to identify it, the reasons to not share it, why does that seem to not be filtering through? And in fact, some people believe that when the facts are put out, that in itself is part of a broader conspiracy.
Well, I guess it's a number of different things. You know, I think that certainly in South Africa, the public are becoming increasingly aware of what misinformation and disinformation is. We're seeing greater numbers of people, for example, reporting to Real 411, which is a system that people can report mis and disinformation to. So those, I think, are very strong and very positive signs. I think against that, what you need to see is the state and the media communicating on an ongoing and consistent basis about many of these basic things around public health. You know, we need to help people understand what is a vaccine, how does a vaccine work, how do we know it's not made of fetuses, how do we challenge these kinds of things. We need to take that science, break it down, and communicate it in ways that everyone can understand. And then we need to do it again and again and again and again and again. You know, and that's pretty much the role of what the state should be doing. I don't think that they're doing that, you know, nearly sufficiently. I think if any one of these public officials makes these comments, they need to be roundly disciplined by whatever their organization is. You know, we saw COSATU was a classic example. On the one day, they released a very strong, very powerful statement calling for the immediate adoption of vaccines and making sure that people were getting them. And yet you then saw the president making comments that were fundamentally at odds with that kind of thing. And if you're a member of the public, you just have no idea what to believe, you know. So that kind of thing feeds mis and disinformation, and it leaves someone who isn't an expert, who doesn't know any better, thinking, well, what do I believe? And of course, they're more inclined to believe something that arrives on their device that says this is from a friend, and this is she or he says that these things are really caused by 5G. And that's when it suddenly starts to become a lot more believable.
Now, some communication experts have said that the way in which government has been communicating could also be fundamentally different. And, at UKZN, with some of the work that they've been doing, they've shown that the message filters through much better when there's more direct contact with communities. But of course, COVID-19 has made that practically impossible in some respects because there's such limited movement. But how can that communication be improved under the current circumstances? Because it seems to me, William, that it's not good enough to just be broadcasting the messages on the different media that's available, or to be writing about it, but that people actually need those that they can trust, who can tell them what is the truth and what isn't, so that they're able to take it, I suppose, with more ease.
Yeah, 100%. I think that to a large degree, the government have done really well, and they've supported a number of excellent programs that have been run. And you've seen a number of very, really powerful initiatives around communication around COVID. You've seen COVID comms, where you've had, communications professionals putting out messages in all sorts of African languages. You've seen government trying, I think, under very difficult circumstances. Our media have been trying to make sure that they cover it with few resources, et cetera, et cetera. So I think that everyone's been making an effort. I think that the problem, though, is that in as much as COVID-19 is an epic health crisis, it's equally an epic health communications challenge. And that means, as you said, it's not good enough to just have the messages. You've got to have that ongoing, continued engagement and communication with people at all levels, and it has to go all the way down to community levels. And as much as we're saying to people, wear your mask, wash your hands, sanitize, etc., and distance, we need to also be making sure that we're communicating the basics about how this virus operates, why we know it's real, how do we know that a vaccine works, all of these kinds of things. And that's not going to happen without a very clear, comprehensive plan and a very clear, comprehensive strategy. And it also needs to filter from all the way from the top and all the way down to the bottom. And when someone starts to speak out of turn about that, when you get someone who's in senior public office saying things and making comments that are about vaccines, or that, they're not going to take them, or we don't believe in these things, those people need to be disciplined, because that is the same thing as effectively saying, well, ignore these guidelines. It's a very real problem for for government and for our media to make sure that they're communicating when they're up against very well-resourced people, and people who frankly have a much easier job. It's a lot easier to make up a lot of nonsense than it is to actually explain how a vaccine works.
We've seen recently, of course, platforms like Twitter banning the US president for some of the information that he's been putting online. And, it's somewhat unprecedented in the way that it has happened. Do you think that this opens the door in particular for these accounts that are primarily responsible for producing this fake content and distributing it on their pages?
So what we have seen in South Africa with our platform is that where people have been found to be putting out, sorry, forgive my domestic disturbance, where people have been putting out disinformation, that's where we've seen that the platforms have thankfully operated swiftly, and they've removed those accounts. So that's not something that's unusual. What is unusual, of course, is that they did it to the President of the United States. Of course, they probably should have done it some time before that, or certainly started to sanction his posts that were clearly out of kilter with their own guidelines and with their own processes and policies. So I think that what we are going to see, I think, is greater attention to how we deal with these things. And of course, therein lies the challenge, because what you don't want is for that problem to be left only with the social media platforms. Similarly, you don't want it to be left only with government. Why? Because around the world, when governments get that kind of power, inevitably they tend to silence those who critique them and be a lot more lenient on other things. So you need a far more nuanced approach to dealing with this particular challenge.
William Byrd, he's the Director of Media Monitoring Africa. Thanks for your time tonight, William.